Hello and welcome to another webinar from Diagnostic Solutions Laboratory. Today's webinar, Yeast Overgrowth, Triggers and Treatments, is presented by Dr. Daniel Kalish. Dr. Daniel Kalish is dedicated to teaching doctors functional medicine philosophy and practices. He has trained over 1,000 practitioners worldwide in the Kalish Method, which solves patient challenges through a proven lab-based approach by means of the Kalish Institute's educational programs. So whenever you're ready, Dr. Kalish, you can take it away.
Oh, thank you very much. Glad to be here. And for those of you that don't know me too well, as was just mentioned, I've been teaching functional medicine for a long time, trained a couple thousand practitioners in how to do this through my various mentorship programs. And now I'm working really closely with one of the head scientists in our field who's been retired for a while, Richard Lord. And Richard and I have been working together 2 days a week for the last 4 years, putting together all kinds of more advanced lab curriculum. And it's just a great time to be doing functional medicine because there's just so much going on in our industry right now. But putting all that aside, we're going to stay focused today on just talking about yeast overgrowth. And it's one of the harder issues to deal with in a lot of different ways. And so I thought, sometimes it's helpful to just maybe get a little history and background on what we're talking about and some perspective. So, in the 1970s, and I'm not making this up, if you're one of the younger doctors, you might not know this, there was a man named Dr. Crook. It's too bad he didn't change his name, but Dr. Crook wrote this book, I forget the name of it, was like Candida, the Hidden Epidemic or something like that, and it just became this thing for everyone in the natural integrative medicine world to, test, not to test for it, but to treat yeast overgrowth and fungal overgrowth. And despite his rather unfortunate name, he was really brilliant. And the idea of treating yeast when I came into my practice was just sort of like a given. This is like early 1990s. And then, and even now, everyone struggled with how to test for yeast. And we can talk a little bit more about that later. But because I think in the 70s and 80s, anti-yeast, antifungal treatments were just so dramatically effective for so many patients, they became really popular, and that when lab testing came around to be more commonly used in functional medicine, that we started to understand some of the dynamics that were underlying these chronic yeast overgrowth cases, and some of these people that have chronic yeast overgrowth who are greatly relieved by anti-Candida treatments are going to have something else going on also, like C. difficile, H. pylori, parasitic infections, etc. And so that's just something to be on the lookout for, right? Because that happens frequently. And that's why you have to do these kinds of tests like the GI map. Because if you have a chronic yeast patient and you treat them for the yeast and they get better, and then they are not better anymore and they slip back, or even if they do get better and you think that they're better, it's very likely that they have some other underlying infection as well. So you have to do the testing to really figure out what to treat, and many people, if not most people that have chronic yeast overgrowth have something else going on that you're going to want to know about, again, like H. pylori or Giardia or parasites, etc. So just might keep that in mind. The treatments for yeast can be incredibly dramatic and just in terms of how they benefit the patient. And then think, a really good yeast case that you do a good job treating will get you as much, benefit with the patient as probably anything else that you could do, because chronic yeast overgrowth just really messes people up. And so because it's such a dramatic and symptom changing, life changing kind of treatment, it's something that you want to do, if ever given even the slightest hint that there is a problem there. And so it's not something that you want to ignore in anybody. And in fact, there's a lot of different companies I've worked with over the years, different lab testing companies, different supplement companies, different, brain-related health companies. I can think of like half a dozen of them, where they made yeast treatment just an automatic part of their protocol. In other words, they didn't even bother doing the labs. They're just like, assume everyone has yeast, give them a little bit of an anti-yeast treatment, in the beginning of their program, just so we know that they're going to absorb this other stuff that we want to give them, right? So anyways, if a hidden yeast problem can cause malabsorption and can cause all other types of hormone balancing or brain balancing programs to fail, so it's just something you want to keep top of mind when as you're doing patient workups. It's incredibly important and not that difficult to fix, given the benefit that people could potentially get. Okay. All right. So now, in terms of the yeast overgrowth, the one that we're often most of the time talking about is Candida albicans, and it's normal for this to exist to a certain extent in the gut, right? It's not always a concern. Should be able to have some yeast or fungal overgrowth happening, and your immune system is supposed to be monitoring it. However, if there's any hint of weakness in the system, then this can be a really big problem. And there's different forms that this takes, and there's different treatment options you may want to do depending on what's happening. And then the common reasons why you see yeast overgrowth, but it can be many other things other than these, would be antibiotic use, someone who eats a high sugar, high carb diet. Mercury toxicity is kind of famous for leading to yeast or fungal overgrowth. Birth control pills, kind of famous for leading to yeast or fungal overgrowth. You can have low immunity in the gut, low secretory IgA. Gluten intolerance famously leads to yeast overgrowth. In fact, a million years ago, when I had a job working at one of the labs, I don't know what I was doing in those. Must have been in my early 30s because I had a lot of time on my hands. This must have been before my son was born and before I got so busy because we were just sitting around the lab and honestly we were kind of bored. We didn't have anything to do. And so, and I wish I was bored anymore. This doesn't happen. But anyways, we're sitting around the lab. We're kind of bored. Like, what are we going to do? What if like 5 guys do in a lab and they're kind of bored? So we laid out all of the testing for yeast overgrowth that had been done that year. I was like in May, so maybe it wasn't like the whole year, but like a whole bunch of these, like hundreds of these tests. And then we took the same exact patients and we laid out their gluten markers and we looked at them side by side in this huge conference room that was empty, right? And we're like, whoa, look at this. It's the same people. In other words, like the more severe the sensitivity was to gluten, the more likely they were to have a yeast overgrowth. Now, that's not exactly a research study. It was just sort of like a pilot study or investigative little project from a bunch of bored lab guys. But that convinced me that there's a really strong connection between what we eat and the yeast overgrowth problem, right? And so one of the first things you want to do with anyone who's got a yeast problem is just take them off of gluten, whether they show positive on the gluten test or not, just at least for the time while you're going to be treating the yeast. Okay, maybe not forever, but at least for a short period of time. Okay, short period of time would be like maybe 60 days. And then the symptoms of yeast overgrowth are kind of a hard thing to even keep track of because it can be anything. And this is like a partial list, really. Think about it. But the classics would be thrush or some kind of yeast or fungal overgrowth in the mouth and throat. You can have sinus infections, again, very oftentimes linked to yeast or fungal overgrowth. There's ear infections, migraines, just the whole low-grade GI problems. And especially people, obviously, they get worse when they eat starchy foods or eat worse when they eat carbohydrates. The problem with these kinds of lists is that it makes you kind of think a little too specifically just about, it's almost like you're profiling yeast, like yeast only does this, and so when you look at lists like this, these are the obvious things that you should just memorize that yeast does. But then when you treat a lot of yeast overgrowth, you're going to realize that yeast can also cause anxiety. Yeast can cause infertility. Yeast can cause major episodes of depression. Yeast overgrowth can cause just about anything because the hallmark of yeast overgrowth is malabsorption. When your gut's not absorbing nutrients well, all kinds of other problems can happen. And so I don't know, I think it's always worth memorizing these kinds of lists. So the no-brainer kind of yeast overgrowth symptoms just pop right to the top of your head. But then also as you treat yeast, kind of add to this list in your own mind so that you're not kind of stuck with just this one short list, right? Because yeast can cause just about anything, allergies, asthma, whatever it may be. Okay? And then yeast overgrowth often means that you need to look deeper into the situation. I would never, ever treat someone for yeast and think that it's all going to be over just when the yeast is gone, because it's very common that yeast overgrowth is secondary to other infections, whether it could be Giardia or Cryptosporidium or H. pylori. Some other organism can be present, which is part of what's allowing the yeast to proliferate. So be super careful with that. And once in a while, because there's always exceptions to everything. Once in a while, I'll get a case where really the only problem is yeast overgrowth. And that's the main and only thing that's wrong with their gut. But the majority of time, it's a little more complex than that. However, the anti-yeast treatments are so clinically efficacious. They change people so much in terms of how they feel that you can do a yeast treatment and think, oh, this must be the end of it. And, there's one thing it's a little complicated. It's kind of like not what you would think intuitively, but you can have like Giardia or crypto infection, or H. pylori for that matter, that's driving the yeast overgrowth. You might get more symptomatic relief from the yeast overgrowth treatment than you do from treating the underlying problem. So just because a problem is the underlying problem doesn't mean the person's going to get more symptomatic relief from treating it. Does that make sense? You would think that went through, right? So the prime underlying problem may generate less benefit to the patient in terms of symptomatic relief than treating yeast. So you could have Giardia as the main underlying problem. You do an anti-yeast program and they feel dramatically better, and that gets you kind of fooled into thinking that you don't need to treat the Giardia or not even to look for the Giardia or whatever it may be. So anyways, yeast just always means look deeper. If you just keep that in the back of your mind, you'll be in great shape and you won't have those patients that come back, 2 years later and say, hey, I felt great for like a year, but now the problem's back. So there's different levels of Candida, and you can do these stool tests that help you determine whether the Candida is present, right? It can also be an invasive yeast overgrowth. There's all these different levels. You can just simply be carbohydrate digestive problem, right? Like this person needs to eat healthier. I mean, you can certainly have an alcoholic who has yeast overgrowth because they're drinking alcohol, or someone who has a food addiction or food eating disorder that has a yeast overgrowth just because they're eating huge amounts of sugar every day. And then just keep in mind that the absence of yeast on a stool test doesn't mean it's not there. So there are cases, it's true for parasites, it's true for everything that we treat gut-wise. You can have a yeast overgrowth and miss it on the lab. So it's one of the few things in my practice that I often treat, even if the labs look like it's not there, because it's such an important issue, and sometimes the labs miss it, And there's not a lot of things that you want to just treat preventatively like that, but yeast is one of them, I think. Probably out of all the programs that I run that don't have lab data to back them up, the yeast treatments are probably the most often, most frequently done, right? And you also want to kind of anticipate yeast, because like if you have, let's say, a Giardia case or a crypto case, and you know that based on the lab, and they don't have any yeast overgrowth on the lab, it's very likely that when you get rid of the Giardia or crypto or H. pylori, that the yeast is going to proliferate. So oftentimes you can do a sort of preventive yeast program. You get rid of the main infection, the crypto, Giardia, H. pylori, and then do anti-yeast protocols after that. And then, of course, you always want to retest. You can't just treat someone for one of these infections and just kind of keep your fingers crossed that it's gone, right? The retesting is an important component in all this. So in terms of the terminology, so there's commensal yeast overgrowth. That would be like get your diet together, stop taking, whatever medications causing the yeast overgrowth. That would be like the easier cases, really, where it's a lifestyle driven kind of thing. Typically it's not that bad yet. Then there's invasive yeast. Now the yeast has penetrated into the gut lining itself, and that's going to start to poke holes in the gut lining and cause what we call leaky gut, right? Which is not a good place to be. Now, invasive yeast, much harder to kill. Invasive yeast, you're probably not going to get rid of it just with a dietary change. You're probably going to need to do either medication or supplements. And in terms of either medication or supplements, I think a lot of this, it can go either way. I'm a chiropractor by training, so I don't know, 99% of the time in my practice, treated yeast overgrowth with non-prescription items, and I hardly ever have problems with doing that. Maybe every couple of years I have to refer somebody out for a prescription for yeast, but it's not that often. And then I have great friends that are medical docs, and they just prescribe nystatin and diflucan for yeast, and they have great results too. So I don't know that it's really that much different. If you're a medical doc and you want to prescribe medications for it, more power to you. If you're not a medical doc and you're more, you want to do the herbs, I really have very rarely found it to be a problem to get rid of yeast with the herbs or the natural products that are antifungal, anti-yeast. Is it better to do it with, I don't know which way is better, honestly. I think you can do it either way. I'm kind of open to people doing it either way. But when it's an invasive problem, you're usually going to probably, have to kill it. Then there's systemic yeast. Now that's something that's only really going to happen in someone who's hospitalized. We don't really deal with that in functional medicine typically. Those people are going to be quite sick. And that's not what we're talking about, right? We're talking about either commensal or invasive yeast. So systemic means it's traveling through the bloodstream and your immune system is in some serious trouble and you're probably in the hospital already for some other major problem, some immune compromising problem, right? Okay, then again, you can, whatever you do for the treatment, whether you use medications or use the natural anti-Candida compounds, the yeast will just come back if you don't address all the different lifestyle factors, and all the different factors that relate to the gut, like parasites, diet. We had this one patient years ago. I never forget this guy. I don't know why. Some patients just stick in your mind, even a million years later. And he was running a hedge fund in Chicago. I remember him telling me this so clearly one day, $700 million, Dan, of other people's money. He had a staff of like 20 people. I'm sure he was pretty rich, but he didn't have 700 million. I don't know, maybe he had 50 million in the bank. I don't know how much he had. But anyways, and so this whole thing with this guy, Richard, went on for like 2 or 3 years, where I would talk to him like every 2 or 3 months, and he kept showing this yeast overgrowth in the lab testing. And we kept treating the yeast and it kept getting better and it kept coming back. I mean, to the point I look at it now, it's almost like comical, right? This just kept happening over and over and over again. And then as soon as he would take any time off of work, it would all go away. It would all go away. And so after the end of a couple years, I finally just negotiated with him because he was a negotiator, right? I finally just like laid it down. I said, look, we can't keep doing this. I mean, you could buy supplements for me the rest of your life. This just isn't making any sense that you have this yeast overgrowth. So we cut a deal where he agreed to take his wife on a 1-week luxury vacation every 3 months, which was basically a way of us forcing him not to work, right? Just get him out of town and do something that was good for the family, good for his marriage too, right? And then at the holidays, he had to take either 2 or 3 weeks off. And believe it or not, just getting this guy to work less solved his yeast overgrowth problem. Now that's kind of an extreme case, and it took me years to work through that, but just it really does matter when you have these like bullet points on a slide and it's like stress matters. It's not an abstract thing. If the person's stressed enough, then the yeast programs won't work really very well at all because stress lowers secretory IgA and the yeast is going to proliferate when the immune system is weak. And that one guy in Chicago is kind of an extreme example. Most people, can't work hard enough that they can cause a constant yeast problem, but some people can, and it's something to be considering of. Same thing if the person's an alcoholic and they're drinking alcohol every day, or if they're have a food addiction or eating disorder and you're eating sugar every day, you won't be able to get the yeast under control until you really get a grip on whatever's driving the lifestyle part. Okay, so we just always want to mention that as a key component to these programs, and it's not like a or lip service kind of like nice to have kind of thing. It's more like you have to do this also or the programs don't work. And with yeast overgrowth, perhaps more so than the other GI infections, this becomes incredibly important because yeast can proliferate just because the person's overeating carbs or just because, and you can't really get Giardia just because you're overeating carbs, right? So it's unique yeast overgrowth in that it's tied so directly into our immune response. So in my practice and the way I teach the mentorship classes and whatnot, we always test and correct the adrenals as part of the anti-yeast program, right? And like the Chicago guy, like all these other people that I've worked with, that's not like a optional thing. That is the heart and soul of the program, is to get the lifestyle stuff dialed in, right? It's not a nice to have kind of optional thing. It's a centerpiece of the actual program. Then you get rid of all the bugs, right? Whatever it may be that's present, including the yeast or fungal overgrowth, and then get all the good organisms to come back, right? So that's the kind of general sequence. And if you follow this, it should work almost every single time, basically. Again, the bigger things that you just don't want to forget about that can be lurking in the background is that if the person's eating a lot of gluten, and especially if it's grains that were produced in the United States, where we use a chemical called Roundup that has glyphosate in it, then you can have problems either from the gluten or from the chemical addition that we've decided is a good thing to spray in our crops, and that in and of itself can cause yeast overgrowth in some people, okay, or continue a yeast overgrowth problem that's already gotten started. And then antibiotic use. Now, some people have to take antibiotics. We don't want people to be harmed by not taking medications, and so you just need to accommodate for that in the programs and see what the patient's history of antibiotic use has been in the past, how long they've been on them, how often, when they need to go on them. And of course, right after any round of antibiotics, to make sure they do probiotics and whatnot. Birth control is kind of more controversial. You don't want people having unwanted pregnancies. That's obviously not a great thing to do for a patient. At the same time, there's doctors, one of the early doctors that trained me, Michael Leibowitz, would not treat patients for yeast if they were on birth control because his fear was that they were just going to come back again. So it's just another factor to consider, bad diet. I talked about my hedge fund boy. Stomach and HCl issues, right? So if you're not making enough hydrochloric acid and food's hitting your small intestine not well digested, same thing with pancreatic enzymes and gallbladder problems, you can have a pretty chaotic, dysbiotic, bacterial and yeast-ridden small intestine just because your stomach, your pancreas, or your gallbladder are not making the secretions that they're supposed to. So chewing your food really well, taking a minute or two after you eat to let your digestion start to kick in before you run off and do something else, those are pretty important. And then one thing I do refer out, I don't know, not every day, but probably at least twice a month in my practice, I'll refer patients out for visceral manipulation. And for those of you that have not heard of it, there's a osteopath who's very famous named John Upledger, who has the Upledger Institute. And there's another osteopath who's also very famous named Jean-Pierre Barral. And Jean-Pierre Barral has been sort of the worldwide teacher of this technique called visceral manipulation. And he teaches it through typically, or his students, I should say now, teach it through the Upledger Institute out of Florida. And they're the best of the best at showing practitioners, including osteopaths, chiropractors, massage therapists, physical therapists, how to manipulate the organs. And so if you have a really restricted gallbladder or stomach, or your small intestine has a lot of adhesions, is not working well, simply because of mechanical problems, then visceral manipulation can be one of the keys to getting people's chronic digestive problems to go away. So if you have scar tissue or adhesions from an old surgery or from an injury of some kind, or just from chronic inflammation in your gut that's impeding the flow of the bile or impeding the stomach's position or not allowing the small intestine to contract properly, then you can have some pretty serious problems like yeast overgrowth that come about in relation to visceral manipulation. So again, that's, 1 or 2 referrals a month. That's not a ton of people, but that's a pretty regular thing that I see in practice where there's a mechanical problem that's connected to the GI problem. And the least you can do if you suspect it, send the person out so they can get a visceral manipulation analysis and get it taken care of if it's appropriate. Okay. So then, what's really going on with yeast? Where there's this fermentation process, right? And that's where people get these typical symptoms, the bloating and the gas and cramping and all that. Then there's inflammation that happens as a result of all this. And when the gut is inflamed, bad things happen all across the body, right? And the gut, we now know the microbiome is so essential for other body functions that it's not so surprising now that a problem like yeast overgrowth can result in so many different symptoms. And then if that wasn't enough, that your gut lining's inflamed, then you're having this malabsorption issue as well. So now you're not absorbing your carbs, everything's going into the small intestine and large intestine, is not being broken down properly, and things just go from bad to worse. So yeast is so surprising in the different kinds of problems it can cause. Chronic inflammation, malabsorption syndrome, all this sort of stuff. So now there's a couple other organisms I wanted to talk about, and then we'll look at a couple of cases real quick, and then we'll have some time for questions at the end, okay? So C. difficile, just always be on the lookout for this one. Also can poke up itself after antibiotic use. And I kind of think of it in the category of, when we think about gut problems, there's parasites, that's one thing. H. pylori, I kind of put in its own special category of badness. And then C. difficile, I kind of lump in with yeast overgrowth, these other things. Not to diminish its, but problem, but it's something you just keep in the back of your mind whenever you have a yeast overgrowth. Just make sure you look at the C. diff markers and that there's nothing wrong there. Okay? And then there's a whole bunch of treatments. The most common one is Saccharomyces boulardii to just flush the yeast, flush the Clostridium difficile out. And ironically, Sac boulardii is actually a yeast organism, but it's a good one, right? That can be extremely good for getting rid of some of these bad organisms. One of my favorite supplements of all time, Sac boulardii. I don't think this is true right now in my clinic, but for a lot of years, it was the #1 seller in my clinic. Sac boulardii, just used to give it to everybody for everything because it's so helpful. So if you're not using a lot of Sac boulardii, you should think about it, incorporating that maybe a little bit more. It's a really great product. Okay, and then also when we're thinking about C. diff or yeast overgrowth and how is this really affecting things? Well, we have this microbiome, right? These organisms, and one of the things that these organisms are doing is helping us, the good organisms, the good bacteria, helping us break down fiber and turning that fiber into short chain fatty acids, which is a major fuel supply for the gut lining, right? And if that system is not working well, then you can have a lot of different problems that are a result from an imbalanced microbiota, right? So again, if the organisms in the intestinal tract are out of balance, for example, if yeast is proliferating, then you're not going to get enough short chain fatty acids going. The good bacteria are going to get crowded out. There's only a certain amount of organisms that can exist. It's a finite space. It's not like a planet that you could just keep filling up. It's basically more like a telephone booth that you could cram a certain number of people into. And I forget the exact numbers. I don't know, any of the science people can correct me on this. It's something like 10 to the 12th organisms per gram of stool or something like that. But anyways, it's a finite number. It's a certain number of billion or trillion organisms that can fit in a gram of stool. So if you have a ton of yeast overgrowing, the good bacteria just physically get displaced. There's just not enough room for them. There's only a certain amount of stuff that can grow in here, only a certain amount of resources. And as you all know, these good bacteria are so important for all these different immune functions and neurological functions and helping prevent autoimmune illness and all kinds of things. So yeast overgrowth can have, problems that cascade outward from just the actual fungal overgrowth itself. And then, I know I mentioned this a bunch of times, but this is the thing that tripped me up the most all these years in practice, is that if they do have a yeast overgrowth and you do successfully treat it and they do feel better after the yeast treatment, don't get suckered into thinking that's the only thing. Always do lab testing because they might have crypto, giardia, ehisto, blasto, roundworm, pinworm. There may be something else going on, and more often than not, there is something else going on that you'd want to treat in addition, okay? And then what we're really worried about here is getting the normal intestinal villi back, the reestablishment of the healthy gut lining, and that's kind of the goal with all these different treatments, is to get the microbiome back and to get the health and functioning of the intestinal tract back as well. Okay, so let me show you a couple labs. I'll mention for those of you that came late, we have a lab interpretation boot camp starting June 1st. on functional genomics, and you get 20% discount if those of you that are interested. And we have in the middle of the summer in August, a telehealth business essentials bootcamp that's just straight up business class. If you guys are interested in that, you can join, and you get discounts on either of those if you use that code there, DS2021. And these the boot camps are short 2-month classes. We have a live call every couple weeks, and they're kind of intensive, dive into it, get it figured out kind of courses, versus the 1-year mentorship that I do that's much more detailed and kind of drags on for a full year. Okay, so let's take a look here. GI map. First page clear. Okay, hang on a second. My computer's not being very friendly. There we go. It won't scroll unless I tell it to. Kind of a borderline H. pylori. That's not what we're talking about tonight, but anyways, or today, that's a little confusing. Normal bacteria, that's too complicated to talk about right now too. Opportunistic bacteria, oh gosh, that's complicated. There's so much to learn about. Okay, here we go, yeast overgrowth. So they have a nice little section. It's titled fungi and yeast, so you don't have to wonder what's going on. Candida, Candida albicans, Geotrichum, Microsporidium, okay, they're all right here. And the treatments don't vary a whole lot depending on what yeast is positive. Now, when you see a high yeast marker, now you have to think after what we were just talking about, is this systemic? Well, no, that's not possible. They would be in the hospital and they would be extremely sick, right? So it's not like, it's not life-threatening. We're assuming this person is not hospitalized. So now we're wondering, okay, is it commensal or is it invasive? And you can't really tell from the test. You just know they have a yeast overgrowth. So as I said earlier, you just want to take yeast really seriously. It's easy to get rid of in general, given how much benefit people experience. And so the way that I was trained was to do three different herbal products at the same time for at least 2 or 3 months, and then to stop, give the person a break, and see where we're at, and repeat if necessary. So, there's the best of hits of, killing yeast. There's berberine, olive, oregano, there's palo de arco, there's colloidal silver, there's caprylic acid, undecanoic acid, grapefruit seed extract. There's at least 10 or 12 products that people use. And again, the general instructions I received as a young practitioner, which I've stuck to, are to use 2 or 3 products together at the same time in a pretty potent anti-yeast program to start off with 1 or 2 weeks of dietary control, so cutting out the carbs for 1 or 2 weeks. Not that many people can cut out carbohydrates forever, right? So you usually want to do the dietary control first, 1 or 2 weeks of a very low starchy carb diet. That in and of itself will kill a certain amount of the yeast. And then starting in with the supplement program 1 or 2 weeks after they've initiated the diet. Then how long do they keep doing the diet? Just depends on how long you can convince them to keep doing it, Is longer better? I don't know. I had this woman in my first or second year of practice, and she came in. I said, you have a yeast overgrowth. I gave her the yeast supplements. She came back. She felt amazingly better. I was like, okay. And then I didn't see her again for like a year or a year and a half or something. And then she came back. This is a true story. She came back like a year later. I'm like, how are you doing, Janie? And she's like, I'm doing great. And then what are you up to? And I'm like, I haven't seen you for a while. And she's like, well, I've been doing your Candida diet. And I'm just thinking, what? She followed the whole diet for a year. I never said that. I didn't say do this diet for a year, but she just felt so much better on it that she stayed on it for a year. And then I was seriously thinking like, wow, lady, you are crazy. Like, who could do that? So it's not a lifetime kind of diet. I mean, unless you're diabetic or you have some, just had a heart attack or something. I mean, there's reasons why you should not eat carbs, right? But for most people, it's very difficult to cut out all carbohydrate, for months and months and months. So we usually ask for, a reduction for a week or two, a pretty strict anti-Candida diet for the first week or two. Do that first, they get a die-off reaction from that, which means some of the organisms are going to die. They may have some side effects from that. Then get into the killing program, and then have them gradually put in small amounts of starchy carbs and see how much they tolerate. I myself I cut out starchy carbs about 6 weeks ago, I feel great. So, I mean, but most patients won't do it for very long. So I'm not against cutting out starchy carbs. And in fact, I have cut out starchy carbs and I feel great right now. I've lost 6 pounds in like 6 weeks and, feel like $1 million, have all this energy. I'm rowing every morning, my new row machine I bought and everything. It's kind of my post-COVID recovery program here. But, a lot of patients won't be able to do that. So you have to have some flexibility with the diet. Maybe they do the Candida diet for a couple weeks really strictly, but they don't have to do it for a year. Okay? You can see this person also had low secretory IgA, which you're often going to see accompanying yeast overgrowth. And again, this is not too hard to see on the labs. So look at another lab here to get you familiar with these. There's the normal bacterial markers we're not really concerned about for right now. There's the dysbiosis markers. Again, we're not super concerned about. And what we really want to think about is yeast. And remember that yeast overgrowth, if you see Giardia on one of these labs or crypto, seriously consider treating the yeast too, okay? Even if it doesn't show up on the test, because a lot of times the yeast will start to happen right after. And you can see this is a nice one. You see this all the time. We have this pattern of dysbiosis. If you look at the opportunistic bacteria, there's a whole bunch of them that are high, 5 high opportunistic bacteria, and then you have the high Candida marker. So for those kind of situations, usually you want to treat the yeast and the dysbiosis potentially at the same time by choosing herbs or antimicrobials that are effective against both. Do the killing phase with 2 or 3 products, high potency for the first couple of months. Start it off with a week or 2 of the diet, and then come back around later and see what you want to do in terms of the dysbiosis. And sometimes the initial treatment for yeast will have enough overlap with getting rid of the dysbiotic organisms that you won't have to do a whole separate program for the dysbiosis. And in some cases, you might have to do a separate program. And then, before I forget, there's also always a question that comes up in the mentorship with the sequencing. So if you have more than one infection, if you have like H. pylori and a parasite in yeast, or dysbiosis in yeast, or what do you do first? So again, this is right back to Dr. Timmons, the old days from the naturopaths that I learned from, and I've just stuck with this. I always would treat, if there's multiple infections, I always treat H. pylori first if it's present. Okay, assuming H. pylori is not present, then I would always go after whatever parasite is present first, and then treat yeast last. If there's no H. pylori, no parasites, you could skip right to yeast. Now, yeast is not put last because it's the least important. It's just that these other infections tend to trigger yeast overgrowth more than the opposite happens. So if you have H. pylori and a parasite and yeast overgrowth, probably do H. pylori first, give the person a break, then go after the parasite, give them a break, and then go after the yeast. Okay? So that general sequence seems to work the best.
That is all the questions we have time for today. So thank you so much, Dr. Kalish, for presenting today, and thank you everyone for joining us.
Appreciate it. Thank you.
Bye-bye.
Bye now.